This is a great question. So right now I actually live in Mississippi. I live in a technically rural community of Mississippi. And so sometimes those barriers are really related to where you are within the country and the world. So sometimes your resources are dictated by what is available around you. So in our community, what we do for diagnostics are labs a lot of times. And then when you have a high enough concern for food allergies, you should be really referring to a food allergist. That being said, depending on where you are within the community, maybe you don't have access to a close by allergist. In some communities like ours, the nearest allergist is within 30 minutes to an hour away. And so that can really put financial strain on some of these communities, especially communities that, like we said, already from a lower socioeconomic status group. Other things that are limitations in diagnostics and treatments include time limitations. So, as healthcare providers, a lot of times we're used to that 15 to 20-minute slot, and that doesn't always give a lot of time to cover everything from education to how we even diagnose that food allergy. So, that's a huge limitation as well. And then, honestly, also oral food challenges. These are one of the gold standards of diagnostics and treatments of food allergies. And if you don't have a structured way of doing that or access to an allergist who's going to be able to do that, that's not really always a possibility. So those are some of the barriers. And of course, when you bring up barriers, you want to bring up solutions as well. But part of the solution making is understanding what barriers exist in the first sense.